Hi, everyone. I'm Dr. Samantha, the maternity mentor. Welcome back to one of our live Q&A sessions that we have here every Monday at 9 p.m. Eastern Standard Time. This is your chance to interact with me live, which I love. And we take this opportunity to answer any questions you might have and put into the chat, as well as to answer any questions that have been submitted on the videos this week. Please follow us here. Please like the channel. Please subscribe because it really helps us out. We're also on Facebook, Instagram, and Twitter with additional content. So feel free to recommend your family and friends to come here as well as those platforms. And we look forward to, answering your questions and interacting with you guys. And I love the fact that tonight we're coming on and we already have a couple questions. So for any of you guys that are joining us, this is a great opportunity for me to answer your questions live. And I try to get to every single one of them. So I'm going to start with Nipun. I hope I said that right. Welcome. So what are the pros and cons of taking a low dose aspirin regimen? I'm over 35 and it's my wife's first pregnancy and the OBGYN asked her to take it. So aspirin is something new that we've been using, I would say, over the last decade or so with pregnancy. We think about aspirin as something that you would not want to necessarily take. But the problem is that because it can cause bleeding, okay? So aspirin traditionally is a blood thinner. And that's why we often think we wouldn't want a pregnant woman to use it because we don't want to see any bleeding during pregnancy. However, what started to happen is we started to notice that there was a correlation between using aspirin and decreasing the risk of certain medical conditions during pregnancy, most specifically with preeclampsia. Now, some of you guys may have also heard this used to help prevent miscarriage, okay? So the thought process behind that was somebody who was having repeated miscarriage. There was a hypothesis that what was happening is early in the pregnancies when the placenta, which is the organ that feeds the baby, was attaching to the uterus. This has the placenta, the side that attaches, has a whole bunch of blood vessels. And the hypothesis was that there was a whole bunch of clots building up that was causing the miscarriage. That has pretty much been debunked, and we no longer use aspirin for that purpose. In fact, according to the American College of Obstetrics and Gynecologists, low-dose aspirin prophylaxis is not recommended for the prevention of early pregnancy loss. Okay? Now, what we are finding is that the use of aspirin for women who have preeclampsia or are at high risk for preeclampsia is absolutely indicated and can serve the purpose of allowing the pregnancy to go longer with lower risks for both mom and baby. For those of you who aren't familiar with this, we can link our video to this, but into the chat. But preeclampsia is basically a condition that's usually characterized by high blood pressure and the failure of one or more organ systems in the body. We usually see failure of the kidneys or the liver or both. Now, aspirin is an NSAID. So what that means is it's a non-steroidal anti-inflammatory drug. So it helps to reduce inflammation, and preeclampsia is an inflammatory condition. Additionally, that high blood pressure, you don't want to have high blood pressure with the increased risk of clotting, because that can just be catastrophic for moms and babies who are experiencing preeclampsia, which is oftentimes why this is recommended. Now, what are some of the risk factors? Okay, because if you haven't been diagnosed, then why would you potentially be getting this? Well, one of the things that you said in your question is over the age of 35. So here are the risk factors that ACOG lists as a potential for using this if you have one or more of these factors. So history of preeclampsia, multiple gestation, kidney disease, autoimmune disease, type 1 or type 2 diabetes, chronic hypertension. If it's your first pregnancy, if you're 35 years of age or older, If your body mass is greater than 30, this is a reflection of how heavy you are if you're obese. If you have a family history of preeclampsia, if you have personal history factors or certain socio-demographic, that means stuff in your life that adds stressors to you. These are all big risk factors for developing preeclampsia. If you have these risk factors, it is then recommended that you start aspirin between 12 weeks and 28 weeks of your pregnancy, with it being optimal to start before 16 weeks. And you would continue this aspirin regimen up until delivery, because this is going to reduce a lot of risks for you. Okay. Now, you don't want to use aspirin just because you've had a prior stillbirth, just because you've had a history of miscarriage, or just because you're trying to prevent preterm birth or miscarriage, unless you have preeclampsia. If preeclampsia or the risk factors are not part of the equation, you don't want to just be using aspirin, because one of the things aspirin can do as an NSAID is it could potentially cause kidney issues for the baby. Okay, so this is your big con. Okay, it is very rare, but babies will sometimes develop some kidney issues. And among other things, it can lower your amniotic fluid, which is the fluid that the baby is sitting in. And this can lead to complications, including a small for gestational age baby. However, I would tell you personally, from everything that I've seen, the risk of a baby developing a kidney disorder versus the potential benefits of preventing preeclampsia, I would take the aspirin. One of the things you can do is, now that you have some of this information, you can go back to your healthcare provider and ask them to explain a little bit further your individual health picture to see where those risks fall for you. Because if you don't really have a lot of the risk factors for preeclampsia, but maybe you have a family history of kidney issues, then the kidney thing might be more important to you than taking the aspirin. So that's what I would say with that. But it is very commonly used now. So just so you know, it's not unheard of, especially over here. So, hi, Jasmine. Could you talk a little bit about the RSV vaccine for pregnant women? Is it FDA approved now? Has ACOG spoke about it? I haven't heard about ACOG speaking about it, and this is a great question, because I'm actually thinking about doing a video on this. So for those of you who aren't familiar, the RSV vaccine is respiratory syncytial virus. Okay, so respiratory syncytial virus is a virus that really affects babies. So everybody can get it, and it's like a really bad cold for us adults. But for babies, and especially preterm babies, it can be life-threatening because it affects the lungs and it makes it very difficult for them to breathe. Now, one of the things that's very exciting about this is, prior to COVID-19, there are vaccines to help with RSV. They were mostly limited to very medically fragile babies coming out of the NICU and stuff like that. After COVID-19, one of the things that happened was we all went into lockdown as a world. And when we did that, our immune systems stopped getting exposed to all the viruses and bacteria and fungi that we're normally encountering out in the world. And I know that sounds scary, but it's actually really good for us. If you've ever heard that whole thing, like you send your kid off to school and they're sick all the time, but it builds up their immune system, that's actually the truth. And once the quarantine stopped and we all went back out into society, what we started to notice was people were getting really sick. And what happened was, at first, people were getting really sick and everybody was worried that it was a new variant. Now, of course, we all know there's lots of variants of COVID running around, and that's a real thing. But what they also noticed those first 6 months or so was that people were showing up to hospitals very, very ill. And when they were being swabbed, they didn't have anything but the common cold. Well, right after that, there was a resurgence of the flu and RSV out of season. Normally, these are our two illnesses that we experience during the winter months all over the world. And instead, they all of a sudden surged at a time that we weren't expecting it. And so the reason why that happened was because all of our immune systems have been protected from exposure and our day-to-day immunity wasn't building up. Okay, so now to our little ones in this vaccine. The reason why we give women certain vaccines during pregnancy is because she makes antibodies against that virus that she's been exposed to through the vaccine. She makes these antibodies and then they pass through the placenta to the baby. So when baby is born with a store full of antibodies to fight off diseases that they may then be exposed to. The same thing happens with breastfeeding. If you do decide to breastfeed, even if you do breastfeeding and bottle feeding, every time you're exposed to an illness, you start making antibodies. Those antibodies cross through the breast milk to the baby, helping to protect the baby from illness. So the FDA the FDA, the CDC, has been looking at this vaccine that has been in the works. So it has been approved, and it's been approved for use between 32 and 36 weeks of gestational age. Now, if you get the vaccine and you deliver within a week or two of that vaccine, they may recommend that the baby get the vaccine when the baby is older. But right now, if you have 2 weeks or greater with the vaccine, then it's showing a pretty good efficacy. So this is really, really exciting because it's a very passive way to go ahead and get yourself vaccinated for something and pass that immunity off to babies. I don't like to get into the vaccine debate too much because I know it's a very hot button topic. What I am going to tell you is that I understand why parents get concerned about all the vaccines because we give so many in such a short period of time. And there are a lot of components to vaccines. Mercury is not one of them, but there are other components that can be rough on anybody's system. But these vaccines protect us from illness. However, anytime we can take in a vaccine and pass off that immunity passively to our babies, that kind of can be a comforting thing to moms and dads because we're taking the brunt of some of that other stuff. It's also, if you look at the Tdap vaccine, and we can link that into the description, there are certain vaccines that your baby's not going to be eligible for right away because babies are born immunocompromised. So, for example, with the Tdap vaccine, it protects against pertussis. It's tetanus, diphtheria, and pertussis. Now, the tetanus and diphtheria we're not so worried about. It's the pertussis part. So pertussis is whooping cough, okay? Now, whooping cough for an adult is nothing. There's many people who get whooping cough and they don't even get a symptom, nothing. You never even know you have it. If an adult gets whooping cough, they don't actually get a cough. They usually just get a very mild cold. But for a baby, whooping cough can be deadly. And I'm in the South Florida area, and in my area, whooping cough is endemic. That means it's here in the community. And we've actually had babies die from whooping cough. Now, you might say to yourself, well, why didn't the baby get the vaccine? The baby couldn't get the vaccine. The baby was not old enough to get the vaccine. So we give this vaccine to moms. We also, to protect her from pertussis. If we protect her from getting pertussis, she can't pass it to the baby. That's why we also recommend close family members, partners, daycare providers all get the pertussis vaccine as well so that they can't contract it and give it to the baby. As nurses and doctors in the hospital, we usually receive the Tdap vaccine, so we cannot bring that virus to your babies. So this is why it's very exciting to be able to offer these vaccines to moms. I can tell you that I think it's a fabulous idea. And I think especially for women who we suspect are going to be giving preterm birth, our preemies are the ones that are very, very high risk for RSV and they're the complications. So I think it's great. So I hope that answered your question, Jasmine. I really appreciate it. Hi, Z. Thank you so much for joining us. All right. So hi, Ellie. My wife is suffering from heartburn, I'm assuming. She is in her 15th week. This is her first pregnancy and she's over 35. Could you please provide any suggestions? So we have a video on this. One of the biggest things, the biggest problems with pregnancy is that unfortunately, we cannot give a lot of the medications that you can normally give or when you're not pregnant. So heartburn is particularly tricky. So let me start with the first part. You cannot take anything over the counter without talking to your healthcare provider. So heartburn medications, generally speaking, contain different elements. Okay, so you'll find aluminum, you'll find magnesium, calcium, different elements. Okay, now some of these elements are completely safe, some of them are not. So for example, aluminum is not something you want to take into your body when you're pregnant unless you've been directed by a healthcare provider. So there are certain medications that you can take over the counter that are safe, but they've, with marketing and everything, they change little formulas here and there. So you need to know exactly what you're taking. So that's number one. You can't just take anything. Usually Tums, which is a chewable tablet, and it's like a calcium base. I think it's calcium carbonate, if I remember correctly. Usually Tums is considered okay. But again, you want to make sure you know which Tums you're taking because there are multiple versions, and that can usually be taken as well as sometimes milk of magnesia, which is generally not used for heartburn, but it's a base, like a basic fluid, so it can help calm it down. So what do I mean by base? So acid is hot and spicy, okay? It's like a fire. So what do you use to put out a fire? You use water or liquid. In our case, a base is a calming agent that calms down that burn or that spice that you feel when you have heartburn. So, what are some of the natural remedies that you can use? Well, let's start with the fact that I mentioned Tums, and Tums' main ingredient is calcium. So, calcium products are generally speaking bases, they counteract an acid. So, a lot of people recommend milk. If you drink some milk, milk can help calm down your stomach. And we do that sometimes in the hospital. But the reason for it is it's because it's a base. So any calcium rich dairy products, generally speaking, will help calm that acid down. Now, if you don't use cow milk product, because there's many people who don't, a lot of the almond milks, goat milk, all of that stuff has that same basic type of chemical. Now, bland food is also good. Some people will actually use bread like crackers or bread itself to kind of absorb up that spiciness of the heartburn because it's acid. That's what's there is acid. You can also even drink some water to kind of dilute what's in there. Acid reflux is tricky. So if you eat big giant meals, it can make it worse because your stomach gets over full and you get this big giant baby sitting and pushing on the stomach in a weird way. And so it can push that acid up and out. So it's recommended to do smaller, like snack-like meals. But at the same time, if you haven't eaten in a while, eating a couple crackers or something may calm down the acid that's in there. So don't just assume that you shouldn't eat at all. You just might want a little tiny bit of something, okay? I do recommend that you sit up after eating for like 15 or 20 minutes if you can to try to let the food settle. And a good tip is to walk around. You want to also go to your healthcare provider. If it's really bad, you want to have them test you for something called H. pylori. H. pylori is a bacteria that causes a severe form of acid reflux called GERD. And H. pylori, it's a bacteria. So if you have it, it's very quickly and simply treated. You get an antibiotic and a strong antacid, both of which are safe during the pregnancy for short-term use, which is all you need it for. You take it for a couple weeks and boom, it's all gone. And this type of acid reflux, if left untreated, can cause some throat issues, which is why you want to go ahead and take care of it if you can. But those are some of my biggest suggestions for this. And there's a couple more in the video, so definitely check it out. But it's a very common issue, so I hope she feels better. So Z, I'm 40 years old, 6 weeks pregnant, spotting and light bleeding for 2 weeks now. Doc said they saw a subchorionic, I see you say hemorrhoids, but I'm pretty sure you mean subchorionic hemorrhage. Please advise, how can I stop the spotting? So unfortunately, you're so welcome, Ellie. So unfortunately, you cannot stop the bleeding from a subchorionic hemorrhage. So we have a video on this, but I'm going to explain what it is, especially for anybody else who's here. So a subchorionic hemorrhage is a buildup of blood underneath the placenta. Okay, so we got a uterus, we got a placenta. This is the organ that feeds the baby. It attaches to the uterine wall. Okay, when it attaches, a whole bunch of blood vessels build here to go into the uterine wall because that blood is going to eventually feed the baby and filter the toxins out of the baby. Well, sometimes one of those vessels will kind of pop, kind of like a bruise on your skin. That's basically a popped blood vessel, and it heals over time. And that creates a pool of blood underneath the placenta. Well, depending on its position, it'll actually potentially leak. It'll spot a little bit. Okay. It's really, really common, believe it or not. And a lot of subchorionic hemorrhages will resolve spontaneously over time. Women will sometimes bleed for a couple months. They may even bleed for their entire pregnancy, and the pregnancy has no other complications. Oftentimes, early in pregnancy, this spot of blood, okay, so this is your whole placenta. The spot may be huge in the beginning, but over time, this placenta gets bigger. And what was once huge becomes really tiny. So that's the other thing with a subchorionic hemorrhage. Every day the pregnancy goes by, it's actually getting smaller and smaller and smaller. And they often will spontaneously resolve on their own. Now, what can you do to stop it? You cannot actually stop that. But what you can do is take it easy and take care of yourself, okay? No bed rest, okay? I have a video on bed rest. You can check that out. But you should not be doing bed rest unless you've been recommended to do that because there's actually complications that can happen from that. But you should take it easy. So don't stand on your feet for an hour making dinner if you can help it. Don't carry heavy laundry or heavy bags. If you're tired, rest for a little bit. Make sure you're drinking plenty of fluid. Make sure you're getting plenty of sleep. Basically, treat your body as well as you can. You don't have to stop working unless your doctor told you. You don't have to stop doing your day-to-day stuff. You just take really good care of yourself, and that allows your body to do what it needs to do. Now, the one thing I would ask you to ask your healthcare provider, if you haven't already, is, are you allowed to have sex? So hopefully, if you are having sex, you're having good sex, which means you're having an orgasm. Orgasms cause the uterus to contract a little bit, okay? Now, during pregnancy, this is extremely safe. There's nothing wrong. In fact, there's some evidence that babies like that kind of rocking motion. But what you do need to be careful of is if you have any kind of bleeding or placenta problems, you need to make sure that it's okay for that to happen. A lot of women are cleared to have sex, but they cannot have an orgasm. So you want to make sure you ask your healthcare provider about that. Now, some women get really nervous and they just don't want to have sex at this time. That's okay also. Like, that's perfectly understandable. But just know that you probably can have sex and it's not going to be an issue. But definitely double check that, okay? Hi, Letty. I see your question. So, what are your thoughts on heart palpitations? My OB said it's normal, and I understand, but I usually have a resting heart rate in the 130s almost every day, and I guess that just worries me. Okay, so I am just going to double check something, and then I'm going to answer your question. Okay, yes, that's what I thought, and I want to make sure that I answer it properly. I do not like that heart rate at all. So let's talk a little bit. Heart rate. So your heart pumps your blood around your body. The point of the heart rate and pumping the blood around is to circulate the blood, which on the front end contains nutrients and oxygen, and on the back end contains toxins and carbon dioxide. So it's moving everything around. It's moving the good stuff where it needs to go and the bad stuff out of your body, okay? Serves a very important purpose. Your heart pumps at a certain kind of regular rate. Usually, I would say people tend to run about 70, maybe 65 to like 85, 90. That's kind of like what I see as like an average, okay? Now, your Athletes can run as low as 50 as a resting heart rate. That's like your normal kind of average heart rate. And some people just tend to run high, so 90s, 100s, right? But anything over 100 is what we call tachycardia. So tachy means fast, cardia is your heart rate. But when you say tachycardia, usually they put the word sinus in front of that. Sinus means a normal rhythm. So there are times when a sinus tachycardia can be normal. For example, you're running on a treadmill, okay? If you're doing it right, your heart rate should elevate and you should be in a normal rhythm, sinus, but a high heart rate. That's showing that you're exercising well, okay? However, you shouldn't walk across a room and develop tachycardia, okay? That is not a good thing. The other thing is, if you are sitting in your chair the entire day at about 1:30, you're running a marathon. Like you're literally running a marathon. Because remember, my example is if your normal heart rate is 90 and you get on a treadmill and you work out for 30 minutes and you come off and you're in the 130s, you're doing well. And yet, if you're just sitting here doing nothing and you're in the 130s, you're running a marathon for hours. That is not necessarily good for your body. So why is it happening? So you need to figure that out. The number one cause that, in my opinion, during pregnancy is thyroid. So you need to go ask about your thyroid, okay? You need to have them check your thyroid. You need to insist. You need to triple insist. It's a very big deal. If your thyroid is out of whack, that needs to be addressed right away because it can cause complications with the baby. Number two, it could be anemia, okay? So anemia is where we don't have enough red blood cells. Red blood cells' job is to transport oxygen around your body because all your cells need oxygen and your baby needs that oxygen too. So if you don't have enough red blood cells, your heart sees this and goes, oh, no, we need more. We need oxygen. And it pumps faster because it wants to get it around, okay? So if you're anemic, you need to know that. And then what can you do? You can go ahead and maybe take some iron supplements, okay? But you don't want to take iron supplements just to take it because you can actually have iron overload. So number two, have them check to see if you're anemic. Number three, make sure you're drinking plenty of fluid. If your blood pressure is too low, your heart rate will increase to compensate for that because you need a certain amount of blood pressure in order for your circulatory system to function. Now, what you want to do, you want to go ahead and you want to drink lots of water. Okay, so lots and lots of water, which is good for you and the baby anyway, and that will also help prevent preterm labor caused by dehydration. I definitely, those are the three things that I would say you need to check. I don't like that heart rate at all. What else can you do? So, Letty, there's a type of doctor called a maternal fetal medicine or perinatologist. Those are the experts in like high risk pregnancies or pregnancy abnormalities. So those are the docs that I would tell you to try to get in with and let them evaluate you. Now, for anybody who's on, right? Okay, so you have some abnormality, any abnormality, right? Your hair's falling out, your toenails turn blue, something. And they look at you and they say, yeah, no, it's normal. Okay, so the question becomes why? Okay, if it's normal, have them explain to you, okay, but why is it happening? Not just like, I'm not worried about it. Why? Why is my specific heart rate elevated? Because what it forces your healthcare provider to do is if they know the answer and it's pretty benign, oh, your toenail turns blue because this vein gets big during pregnancy. Well, all of a sudden you have an answer that makes sense. But in the case of Letty and her high heart rate, there's multiple reasons that this could be high. And therefore, we kind of need to figure out why. Okay. So it's one of those things that I would definitely tell you to get more information. But thyroid, dehydration, anemia, those are my top threes. I hope that helped. Hi, Becky. Can you talk about what to expect before and after a C-section? I love it. So I have a video. I have a couple videos on this. So I'm going to tell you a little bit because it's very complicated. There's a lot to it, but I am going to tell you about it. There's a couple videos. There's at least one video about what to expect before. There's a video about what to look like in the OR. There's also a video about the first 3 hours after, and a video about like incisions and stuff. So I encourage you to watch all of them. But I am going to give you guys some information. So there's a C-section, in my opinion, is sometimes one of the most fabulous births that you can have, okay? Especially if it's a planned C-section. Now, I know this is a very controversial opinion because everybody's like, oh, vaginal birth, it's like so natural. Yes, great, it's natural. I understand that a C-section is surgery, but with a scheduled C-section, right, you get a date and a time. They staff the hospital for you. So they have the doctors, the anesthesiologists, the surgical assists. They have a bed ready for you. Like they have a bed in labor and delivery. They have a bed in mother baby. They have a bed in the nursery. NICU team usually is in the OR because that's just kind of standard for the baby. They know your baby's coming. Like they're literally, everything is in place for you to have that baby. So the best case scenario is to have everything in place. And that's what I like about a planned C-section. So a lot of people get super nervous, but I find that it's actually really cool. Now, C-section, it's like a lot of other surgeries. You can't eat or drink the night before, although some hospitals are starting to use this protocol where you drink Gatorade at 4 a.m. and it helps with your post-op pain. And I really like it. You come in, you're going to sign some papers. They're going to start an IV. They're going to get things going for you. Okay. One of the important things is you're going to get to talk to the anesthesiologist. The anesthesiologist is your best friend during your surgery. And if you're having a vaginal birth and you end up having an emergency C-section, again, this is the same. The anesthesiologist calls a lot of the shots in the OR. They're right by your head. They're the ones talking to you, telling you what's going on. If you're nervous, they'll give you more medication. If you feel a little sick to your stomach, which some people do because of the anesthesia, they help you along with that, okay? So they're there to guide you, okay? And they'll tell you everything you need to know. So if you're having a plan, they'll come and explain it. And if not, they'll explain things when you're in the operating room. When you get into those operating rooms, they're overwhelming. There's a lot of stuff going on, but it's all there and everybody serves a very important purpose and they go quick for a reason. And once they lay you down, they're going to make sure that your anesthesia is working. And they do a couple checks for that. And a lot of people get very nervous about that. But what they're going to do is they actually will pull on your skin after the anesthesia is in place, but you can't see it to see if you can feel or not. And you can't feel anything. Once the surgery gets started, what they'll do is they'll check to make sure you are you. And then once the surgery gets started, your baby's going to be out within a minute or two. It is very, very quick. It's actually the back end of your surgery that takes longer than actually having the baby come out. Now, one of the things I think is the most scary for parents is the baby part. So most hospitals have a neonatal intensive care unit team come to the operating room to take care of the baby. And depending on the practitioner, some doctors or nurse practitioners will walk in and it'll be them and a nurse. Others will come in with 10 people, and you could have a perfectly healthy, perfectly normal baby that's about to come out, and they will have like the entire NICU team with them. It's usually just the preference of the practitioner. So if you see a few people or a ton of people, don't get worried. Now, the other thing you need to know is that some practitioners, they just whisk the baby right over to the warmer where they're going to assess the baby, check the baby, and others will bring the baby over to you first and let you see the baby and then bring the baby over. Again, it's totally like a preference of the provider. Our practitioners are like in the neonatal intensive care unit. This is where sick babies or premature babies go. This is one of the most scary places that a parent can be in, and they know this. So they're so trained and so used to answering everything. They will answer all the questions you have. But the biggest motto is if they don't say anything, that's good news. They will tell you if something bad is happening. That they just know this is part of their instinct. So if they're not saying anything, don't worry if you don't necessarily hear the baby. They're doing what they need to do, and they will explain everything you need to know. Usually in the OR, they'll let you try to hold the baby or take a picture. That oftentimes happens nowadays. and then you go into recovery, okay? And the first 3 hours of recovery, I think, is a fantastic video that I would check out. The biggest thing I want you guys to know, as soon as you're able to walk, you need to get out of that bed. When you stand up, do not keep yourself hunched over because your incision hurts. You need to stand straight up. Because if you don't stand straight up, you're going to end up with a stomach pain and a back pain because you're going to hurt your back. There are 4 kinds of pain with a C-section. Number 1, burning pain at the incision site. That is normal. It's because you cut your skin. Imagine a paper cut. It's paper cut times 20, okay? But it's a burning pain. Number 2, cramping. Cramping like menstrual cramps. You'll feel that inside your belly. That's the uterus cramping back down. That is something a woman who has a vaginal birth also experiences. Number 3, your stomach will feel like you've been hit by a train or somebody's been punching you, okay? It's like a sore, like ache, almost like if you did 1,000 sit-ups. That is because when they're taking the baby out, remember the incision is small, and we have a video on incisions, but they pull this large baby out of there. So they kind of stretch your skin. And so your abdomen hurts from that, okay? And the 4th pain, which is the pain that gets most people, is a sharp stabbing pain. I cannot tell you how many times in my career I've been called into a room by a woman who thought she was having a heart attack. And we've all had. It's a sharp stabbing pain in your chest, usually up by the shoulders, and you feel like you're going to die, okay? This pain is the worst pain. The reason why, it does not respond to pain medication. Why? It's gas. So when they open you up, one of the things we have is like a tube that puffs air into your belly so we can see. Okay, we're using a small incision, we need to see. So when this is happening, there's a lot of air being pushed into your abdominal canal, right? And then when they close you up, they try to get out as much as they can, but some air gets trapped in there. The only way for that air to get out is for you to walk and to move. And in the first 12 hours, you usually can't get out of bed. So laying on your side can help the gas come out. If you feel like you need to burp or you feel like you need to pass gas, fart, whatever you call it, you need to do that. It doesn't matter who's in the room because this is going to help prevent that sharp stabbing pain. And it is scary. It's a scary pain and it hurts. And there's nothing we can do about it. There is no medication that touches it because it's air. It's not pain, it's pressure in places. So I would definitely tell you to walk afterwards. That's one of the biggest things. And when you stand up the first time, which is going to be the worst out of all the times when you're getting out of bed the first time, it hurts the most because you're going to stretch that belly for the first time, but your belly needs that. Your muscles need you to stretch it out. And so what do? You take the pain meds. All of the pain meds are safe for breastfeeding. I am also a lactation consultant. For any of you guys who don't know that, I've been a lactation consultant for over a decade. I'm pro formula and pro breastfeeding, but I definitely know about breastfeeding and all of those medications, even the hard stuff, the morphines, the Dilaudid, the Percocets, they're all safe for breastfeeding. Okay, so don't worry if you need to take pain medicine. Don't get to a 10. It's going to be hard to get you back down to a 2 or a 3, which is considered normal. I see your question, Ali. Just for any of you who are joining us, my name is Dr. Samantha. I'm the maternity mentor. We're here for one of our live Q&A sessions, so please feel free to put any of your questions into the chat, okay? So she is also feeling her leg and palm burning. Is it normal? The description is a little weird for me, but I'm going to start with the palm. So we have a video on carpal tunnel syndrome, and that kind of sounds like carpal tunnel. So carpal tunnel is where the carpal space here gets compressed and it causes pins and needles and sometimes a burning pain in the hand, okay? Usually radiates kind of up like this, okay? And it's very common in pregnancy because in pregnancy, a couple things happens. First of all, there's a hormone called relaxin. Relaxin's job is to relax all of your joints. It's supposed to relax the pelvis to allow the pelvis to open up for a vaginal delivery because you got to get a big head down. But it ends up relaxing everything. That's why women end up waddling at the end of their pregnancy and stuff like that. Well, relaxin relaxes all of the joints in between all your little bones in your hand, and then pregnant women usually gain weight and swell. And so you get weight gain and swelling with a relaxed wrist, and it can cause that compression. So a lot of pregnant women end up with carpal tunnel syndrome. It's very, very common. However, the burning in the feet is not that. And so what I would tell you is she definitely needs to let her doctor know. Burning without having any other context, which of course is hard to get into. We can't really, I can't assess her and stuff. That could be nerve pain. So again, palm could be carpal tunnel and the feet could actually be sciatic nerve pain. So the sciatic nerve goes down the back and through the hip, okay, through the butt and into the hip and then down. The baby will sometimes sit on the kind of the back part of your spine. And what happens is it compresses that sciatic nerve and it'll cause like shooting kind of electric pains down the leg into the foot. And that's sciatic nerve pain. If it's sciatic nerve pain, sometimes chiropractic medicine will help. Sometimes a little bit of being on your hands and knees to try to allow the baby to come off of the spine by like leaning forward can help. It just depends. But that one's a harder one to deal with. And, because there's not much we can do from a pain standpoint. Okay, Sierra. Is leg cramps normal during the first trimester? And does prenatal vitamins cause vaginal odor change? Two very good questions. Okay, leg cramps can be part of any trimester. The most common cause of leg cramps, honestly, in pregnant women is low potassium. Okay. It's very, very common. It's very hard for pregnant women to stay hydrated for a variety of reasons. And so as a result, we end up getting some dehydration, which can change our electrolyte balances. Also, if you have a lot of morning sickness and that limits your intake of food, it can also affect your potassium level. And that is a very, very common cause of them. Now, one of the recommendations that I have is for women to use magnesium. Magnesium is a smooth muscle relaxer. And so it can help with leg cramps. It's also very good for anxiety and it is very good for sleep. So there's several magnesium supplements you can get. You do want to just double check with your healthcare provider that there's no reason that you can't take magnesium. You do want to be careful. Depending on the form, you can only take about 200 milligrams per day. And your prenatal is going to have some magnesium in it. So you want to know how much is in the prenatal before you buy anything. So get a little bit of guidance. If you've taken too much magnesium, the side effect is going to be diarrhea. Okay. So if you get diarrhea or you start to feel like nauseous or different things, you want to skip the magnesium for at least a day until that resolves. That's a sign of magnesium toxicity. But that's very commonly helped. The other thing is you can use a food that is high in potassium. Now, let me just stress this. You cannot take potassium on its own as a supplement, okay? There is some potassium in some supplements, like your prenatal has some potassium. That's fine. That's safe. Do not take potassium pills on your own unless they've been prescribed by a doctor or a midwife. Potassium can cause heart arrhythmia, okay? And this can be very dangerous for you and very dangerous for your pregnancy. However, if we are low on potassium, eating something as simple as a banana can help. And I will tell you, when I was pregnant, I had leg cramps. And my husband would help to stretch out my legs when I would get them. And I oftentimes would eat a banana, sometimes even in the middle of the night, because bananas are high in potassium. And within 20 or 30 minutes, your body's absorbing some of those nutrients. So it can really help. Now, does prenatal vitamins cause vaginal odor change? I'm going to say that it might, because if you think about it, there's a whole bunch of different vitamins and minerals that can change color and odor of a lot of our secretions. The best example I can give you is beta carotene. Beta carotene is a vitamin that is in carrots, and it's what gives carrots that orange color. And if you eat a lot of beta carotene, you can turn your skin orange, your pee can come out orange, different things. So I do think that it's possible. However, I would 100,000% get that checked out. So there are other things that can cause vaginal odor. Now, of course, there are sexually transmitted diseases, but there's also fungal infections, yeast infections, and there's also something called bacterial vaginosis. So bacterial vaginosis is a harmless well, I don't want to say harmless because it can actually lead to miscarriage. But it's a bacteria infection that you can get from your normal bacteria on your skin or from your partner. If your partner's not washing very well and then you guys have sex, you could get it from them. And it's treated with some antibiotics. But the reason why it's important, as I just kind of said, it can cause miscarriage. So you never, any of you having any changes to your odor or the color or consistency of your vaginal discharge, you want to go make sure you get that checked out. Okay. And I think I might have a video on that. I know I mentioned it in different things for sure. All right, Letty, I feel so rushed during my little 5-minute appointments and everything just gets called normal. I'm taking notes and will be asking my OB again because my blood pressure has always been low. Letty, I am guessing your blood pressure is part of the issue. Honestly, Letty, if you don't have any kidney issues or anything like that, you might also want to consider, one of the top things I prescribe, believe it or not, is Gatorade, sugar-free Gatorade. Sugar-free Gatorade. And actually, Sarah, this may actually work for you as well. So Gatorade is an electrolyte solution, right? So it has a whole bunch of electrolytes that we can replace if we are sweating, if we're, dehydrated, right? Now, you guys, I'm assuming, are generally speaking pregnant or postpartum, right? Or somebody who is. So you don't want the sugar part. So sugar-free, definitely sugar-free. But the Gatorade has all those other electrolytes and stuff, plus it's extra fluid, right? So if you're dehydrated, not only is it going to build up volume, but it's going to give some of that back. It's very natural, very homeopathic. I have had a lot of people get a lot of amazing results. You don't want to go overboard. You want to have like one a day, okay? But that actually might help a little bit also because it might replace some of those electrolytes. And for you, Letty, it might give you a little bit more volume. So I would increase your intake, but that might also help too. I'm a nurse and I spend 8 hours on my feet, was thinking that's the cause. Yeah, it could be. Honestly, Sarah, it could be. It's definitely hard to be on your feet for that amount of time. So I would tell you that that's a possibility. It's probably contributing. I also would encourage you to make sure you're getting plenty to drink because that might also, be an issue. Now, if you guys have more questions, please feel free to ask them. Right now, I don't see anything pending, and I want to try to get to some of the ones that we had on the videos. So I have a couple questions that came in on my breastfeeding while pregnant video. So I'm 4 months pregnant, and I have a 1.5-year-old, and I'm still breastfeeding. Should I best breastfeed my older baby? Which month should I breastfeed until for my older baby so that the both babies don't get affected? And the second one said, I'm weaning my older baby, but he still loves to breastfeed. And my OBGYN told me to stop. But when I try giving him formula, my older baby is refusing. What should I do? So breastfeeding while being pregnant is something that is kind of a preference, okay? It can be safe for most women to breastfeed while they're pregnant. There are some women with high risks that should not do this. What happens though physiologically, and for those of you who aren't even considering this, so you understand, around your 5th or 6th month of pregnancy, that's when colostrum starts to form. Colostrum is that first milk that the baby is going to get that's very high in nutrients and the immunity and stuff, right? So when you're breastfeeding, even though you're breastfeeding a baby and have a full milk supply, usually around 5 to 6 months, your breast milk turns back into that colostrum, which means the older baby can't breastfeed anyway. Some women will be able to maintain a milk supply. Now, if your doctor is telling you to stop, you should, because breastfeeding induces a hormone called oxytocin. And you might be familiar with this name because oxytocin is often used to help induce labor. And it helps to induce labor by causing uterine contractions. Well, the same thing can happen. The oxytocin is the milk ejection hormone, but it will still cause contractions, especially if you're pregnant, which is why we usually ask women to stop. If you have a child that is breastfeeding and needs to switch over, I suggest that you do it right away. Now, for the baby that doesn't want to eat formula, it depending on how old the baby is, if the baby's 10, 11, 12 months older, you might be able to just switch the baby to milk, whatever milk you normally would eat as a family or drink as a family. However, if you're the breastfeeding mom and you are trying to wean your baby, that's not going to work. Your baby is smart. Why would they take a bottle of milk from you if the breast milk is right there? Okay, that's like doesn't make any sense to them. Now, one of the tricks of the trade, even for a 1.5-year-old, is kids are very astute to boo-boos. For any of you who don't know what I mean, little cuts, little scrapes. Oh, you got a boo-boo. Oh, let me kiss it, make it better, right? So kids are very astute to that. And they very quickly learn that we often put Band-Aids on top of boo-boos, right? And that makes everything feel better. One of the things a breastfeeding mom can do if she wants to get the baby to stop breastfeeding is she can put Band-Aids on her nipples. And when the baby goes to breastfeed, she tells the baby, which is really a toddler, mommy has a boo-boo. And because mommy has a boo-boo, I can't give you any milk. And then you offer something else. And believe it or not, this trick actually works with a lot of kids. They actually comprehend this idea that mom can't breastfeed, and they will go along with the plan. But it is challenging. As far as what month, it just depends. And if you want to breastfeed and your doctor says it's okay, you don't have to wean at all. So I wouldn't necessarily tell you to stop. We had a question, and I know a couple of you have had questions about C-section, or you had a question about C-section tonight. So it's been 6 months after my C-section. My scar doesn't move downward, but it moves upward. Why and what do I do? So I thought this was an interesting question. And I'm going to tell you that generally speaking, I wouldn't say that I see C-section scars move up or down. They kind of like stay where you expect them to stay. So I thought about this, and I think what might be happening with this particular viewer is that her skin is tightening. So if the skin is tightening and stretching, it might be pulling the actual outer scar up a little bit on the abdomen. However, I'm going to tell you this is not something I've seen. And so what I would tell you to do is to go to possibly a plastic surgeon or your OBGYN and have them check it out and see if there's anything going on. But if you don't have pain, you don't have any kind of drainage or anything, it could just be the way your body's kind of healing. It does take a long time for a C-section to heal. Now, you can start doing everything normally pretty much after 6 weeks, but your body still heals for a while. It's a major surgery. We had a question about pacifier use. So my baby used to cry at 3 a.m., nonstop crying at the time. I used to feed continuously, changing the breast, and she's not sleeping. Can I use a pacifier at this time to help my baby sleep? Will that be a problem? Okay. So this mom sounds like she's breastfeeding. Okay. And the baby is just crying, and she's not getting any sleep. So I am absolutely pro pacifier. Okay. So let's talk about pacifier use. Pacifier use is recommended by the Academy of Pediatrics once breastfeeding is established, which is usually at 2 to 3 weeks of age. Okay. So once breastfeeding is going well, they recommend it for use during sleep because it helps prevent the risk of SIDS. For those of you who don't know what SIDS are, SIDS is sudden infant death syndrome. Okay. This is those unexplained deaths that are so tragic. The reason why they think that the pacifier may work is because the pacifier, when the baby's sucking, keeps the baby in a lighter state of sleep. So instead of a deep sleep, it's a lighter state. Okay. And if you think about some of the other things that help prevent SIDS, it makes sense. The whole idea is to keep the baby in a lighter state of sleep. So breastfeeding, breast milk gets absorbed faster and digested quicker than formula, right? So then it's running through the baby's system faster, so the baby needs to eat more often. Lighter state of sleep. Keeping the baby not wrapped up in these heavy blankets and all this stuff. Lighter state of sleep. If the baby's not super comfy, cozy, warm, the baby's going to wake up more often. Unfortunately, we want our babies to sleep, and that's all we think about is like have the baby sleep. but we don't actually want babies in the beginning in a very deep sleep state because we don't know how responsive they actually are. And pacifiers serve a very great purpose because the baby can self-soothe by sucking, because babies like to suck. That's something they did in your belly, as well as keeping them in that light state of sleep. Now, this mom sounds like she's having a lot of difficulty, okay? So, you should get help from a lactation consultant to make sure you're making the right amount of milk, to make sure that the baby is latching well, that the baby's not tongue-tied and all that good stuff. But in the meantime, if you are not sleeping, you're going to have anxiety, you're going to have depression, you're going to have all this other stuff going on because sleep is essential. And if a pacifier gives you an hour or two of sleep, it's well worth it. The other thing I'm going to tell you is, listen, formula is not evil, guys, okay? And this is one debate that I will happily get into. I am absolutely a proponent of formula, and I am a lactation consultant, a full-fledged lactation consultant. Breast milk is fantastic. Breast milk has so many benefits. Breast milk is amazing. Breast milk isn't for everybody. And I would rather see this mom give a bottle of formula and have a good night's sleep so that she can feel refreshed and like she's back on top of things than for her to be drowning trying to get this to work. Because if she feels more rested, she has that energy and that capacity to try to evaluate the situation, to make sure she remembers to make the call for the lactation consultant, to just do any number of things that might improve that breastfeeding situation. Because sometimes it takes one bottle to change the whole situation and breastfeeding can still continue. So, that was another thing. And I definitely think a pacifier is a good thing for this. We had the question about the pain in the feet from Ali. And we had a question that I think is kind of in the similar thing. We have a video on pelvic pain. And this question came in and said, I'm 10 weeks pregnant and this pain is killing me. I'm crying a lot today due to lumbosacral and pelvic pain. So the lumbosacral is that bottom kind of tailbone part, and then the pelvic is that whole pelvic area. This pain, again, is often caused by two things. One, it can be caused by the nerve pain that when the baby, sciatic, thank you, that's what I was thinking about, sciatic nerve pain, when the baby's head and the uterus kind of compress onto that nerve, causing that pain. But the other thing is that there's the relaxin, which relaxes all your joints. So then everything settles in a way that is kind of uncomfortable, and you can really feel not so great with all of that. And then finally, there is one other kind of pain, which is called it's called round ligament pain. So round ligament pain is very common during pregnancy. So you have your uterus, right? And your uterus is this organ that's kind of suspended in the middle of your lower abdomen, right? So it's not like sitting against like the abdomen wall. It's kind of like hanging there. And it hangs by these strings called ligaments, okay? And what happens is the uterus at first is really, really, really small, right? And so those ligaments are fine. But then as the baby and the uterus gets bigger, right? Now you got this big old heavy baby in there, and those ligaments are now being stretched. And sometimes if you move all of a sudden, you get this sharp stabbing pain, okay? That's usually round ligament pain. Now, if you have any pain, you always want to let your healthcare provider know. You need to let them know because you don't want to just say, oh, well, Dr. Samantha said that sharp pain was round ligament pain, and maybe it was a contraction, right? But that is usually another very common cause of pelvic pain. And unfortunately, there's nothing we can do about round ligament pain. It's just something that's there. We had another question that came in that was about Lovenox and bleeding. And I thought this was a great question. So this came in on the Placenta Previa video. And she says, I have antithrombin 3 deficiency. I'm only 14 weeks, but I have placenta previa. I'm hoping I can get it to move. I have been spotting my entire pregnancy. I'm hoping for the best in a healthy baby. That's all I want. I'm scared to have a C-section due to my dosage of Lovenox, which I believe she was trying to say Lovenox. So this is a good question. So let's start with some of the terms. We have a uterus. At the bottom of the uterus is the cervix, okay? This cervix leads into the vagina, okay? And this is where the baby is going to come out. So the cervix has to dilate, which is open up. So at the beginning, a cervix should be long, thick, and closed. And then when you go into labor, it opens up and then the baby comes down. Okay. Now, uterus, cervix. A placenta previa is where that, remember that placenta that we talked about? Instead of being on the side of the uterus, that placenta is here. So a full placenta previa, and we'll put a link for our video into the description, but a full placenta previa is when it's completely covering the cervix. Now, this is why she is bleeding, because what happens is that placenta previa is leaking a little tiny bits of blood down this opening, because even though it's closed, it can't be completely closed, because then you would never be able to have a vaginal birth. Now, sometimes there's a partial where it's like half and half, and sometimes there's a marginal. That's where it's like right on the edge. Now, the reason why she says I'm trying to get it to move is because as your uterus gets bigger, the placenta can move up, okay? It can move away and the placenta previa resolves. Now let's talk about her Lovenox. So Lovenox is a blood thinner. She has a particular bleeding disorder that puts her at risk for clots, and pregnancy is already a high risk clotting situation. So she's on this medication, which is a blood thinner. And so I'm sure she's thinking, if she gets cut right now, she may bleed more than the rest of us would. So in her mind, she's thinking, oh my gosh, if I'm going to have this big old surgery, I might bleed and bleed and bleed. So with a placenta previa, if you have a completely covered placenta, you can't allow this to dilate. The second it dilates, you're bleeding out, you're hemorrhaging, and the baby's hemorrhaging. It's a medical emergency. So if we have a complete previa, it is a C-section, and it's usually a C-section around 32 to 34 weeks, okay? Because we need to have the baby before she starts to dilate. Again, medical emergency. So in the C-section then, if you're on a blood thinner, what are we going to do? Well, believe it or not, Lovenox is actually the recommended blood thinner for surgeries when people need it. It can actually help prevent surgical complications. We oftentimes will give this to women right before surgery. So if you are listening, and I hope you are, Lovenox is actually completely safe for surgery, and we know it's on board, so we make sure that we have everything ready just in case you do start to bleed more than we expect. Usually for somebody who has Lovenox on board, we're going to go ahead and have blood in the room. We're going to have all the medications that can stop bleeding. But here's the other thing. You're on Lovenox because you're at a higher risk for clotting, which means automatically you're going to be at a lower risk for bleeding than everybody else. So the Lovenox kind of evens the score. So it's actually not as bad as you think. So I thought that was a great question. The next question I see, Sarah, is it safe to do a colonoscopy at 16 weeks? Oh, no, you mean a colposcopy, not a colonoscopy. When your pap smear result shows you are positive for HPV. It depends. So is it safe? It can be safe. Is it recommended? It depends on your risk factors. Most of the time, unless they have to, they are not going to do that until after you deliver, okay? Because most of the treatments that you would need anyway, if, for example, there were cells on the cervix that were positive and say you needed like a cryo treatment or a laser treatment on the cervix, they're not going to do that while you're pregnant. That would put you at risk for miscarriage. So it depends on your personal cancer history, your risk factors, different things. But a lot of times they don't necessarily do the colposcopy right now, and they wait it out until after you deliver. And what you might be able to do is even get yourself scheduled for like 6 weeks postpartum. Like you might even be able to do it at your 6 weeks postpartum check and just, have that done, and on the books. So that's something to consider, but not always. I'm finishing up, but I do have a couple more. I had a couple on the drying up breast milk. One of them said, I stopped my breastfeeding 3 years ago, but I still have some liquid coming out. Could you explain why? And then another one said, I'm 6 months postpartum and I'm trying to dry up my breast milk. I had oversupply and got mastitis twice. Right now I pump 4 times a day for 10 minutes each session, and I'm trying to drop My 5 p.m. session got down to 5 minutes for that session. I'm so exhausted at the thought I was getting mastitis for a third time. My doctor recommended Benadryl or Sudafed. I am doing Sudafed and cabbage leaves. My question is, do I keep pumping my normal times? Do I pump only for relief? Do I quit pumping altogether? So this is a great question. For those of you who are breastfeeding or you're trying to dry up your breast milk, it's very important to watch out for mastitis, because mastitis is an infection of the breast and it can lead to serious issues, and you might need antibiotics and stuff. Some women are more prone to mastitis and plug ducts than others, and there's the lecithin, which is an over-the-counter supplement that can help with that. Benadryl and Sudafed, if you're eligible to use them, can help to dry up milk, and it's a really good start. When you're talking about pumping, I try to do like 2 or 3 days. Like, let's say you're pumping 5 times a day, right? 2 or 3 days at 10 minutes each, then 2 or 3 days at 9 minutes each, then 2 or 3 days at 4 pumping sessions, 9 minutes each, then 2 or 3 days at 8 minutes each, then 2 or 3 days of 3 pumping at 8 minutes. So you see what I'm saying? Like, it's 2 or 3 days, short succession, and you're just making little tiny steps. Make sure you're wearing a bra that's very tight. Don't bind your breast. That will cause mastitis and plug ducts. But a bra that's tight sends a signal to your body that you're not making milk anymore, and don't do it. If you can pump to relief, but a lot of women who have a lot of mastitis can't do that. Cabbage leaves every single hour. Do it all day long. Cold compresses in addition to cabbage leaves. But then one other trick that's actually been working really well for a lot of women is peppermint oil deodorant, because peppermint helps to dry up milk. Okay, peppermint dries up milk. And I have been finding that a lot of women using some peppermint oil, because you have breast tissue right here, peppermint oil deodorant can actually help to speed up the process also. And it's like pretty much all natural. So it's another great way. Now, for those of you who are thinking about this, there is a medication that OBGYNs sometimes try to offer you. It's called cabergoline. And the other name for it is bromocriptine. Whatever you do, do not use this medication. I repeat, do not use this medication. Cabergoline is extremely effective at quickly drying up your milk. It's actually fantastic at it. On top of it, cabergoline makes you feel great. It, like, your mood gets better. It's fantastic, except I don't want you to take it, because when you stop, and you can only take cabergoline for like a week to 10 days, when it gets taken away, your mood plummets, and it puts you at high risk for postpartum depression. High, high, high risk. So whatever you do, do not take it. Okay, so Sarah, I think that what you need to do is you need to have your midwife explain to you very clearly the risks versus the benefits. Okay. A lot of times practitioners kind of skirt over that. They don't really get into the nitty gritty of it. You need to understand, what is your risk for complications? What is your risk for cervical incompetency if she does something to the cervix? What is your risk of miscarriage? What is your risk if you don't have the colposcopy done? Like, does she think you have a 75% chance of having cancer right now? Well, then you probably need to get it done. If she's just crossing a T and dotting an I, can it wait 6 months? Because if it can, maybe that's what you want to do. Now, I can tell you that is a very personal thing. I personally have a history of having abnormal cells on my cervix. Depending on if I was pregnant and what was going on, I might have the colposcopy if I thought my risks were significant. There are many cancers that can be treated while you are actively pregnant. However, in the case of cervical issues, generally speaking, we can't do much until you're not pregnant. So again, it's a risk-benefit thing. And I would have her very clearly explain it to you. Now, one other option for you, Sarah, and this is something you guys should discuss. I think you said you're 16 weeks. Okay. Viability of a baby, that means the time when we think a baby can live outside of a belly, is 24 weeks. So in 8 weeks, 2 more months. Now, That's a preterm baby. We don't want a 24-weeker born. We want your baby born at 40 weeks. There's a lot of potential complications, including life-threatening complications if your baby's born at 24 weeks, right? However, if you were to wait until 24 weeks for her to do this procedure, right? And you were to then start having some kind of labor, your baby could live outside of your belly versus right now, your baby cannot. So that's another option, is for you to discuss maybe just putting it off by 8 weeks and doing it then. Okay. So creativity outside the box. All right. I am going to answer my last question unless any of you guys put anything into the chat. But I thought this was a great question also. So RH factor, this came on my ROGAM video. I recently had a miscarriage and I believe I had a chemical pregnancy after the miscarriage. I am pregnant again and scared that my RH negative will cause another miscarriage. Will taking the RH shot early in pregnancy help? So generally speaking, we don't give it early. And it depends on, I can't say that it's going to help or not. We want to give you the ROGAM shot after you've had the baby. Now, let me explain. RH factor is the rhesus factor. We all have blood types, right? So it's A, B, and O. And after that letter, there's a positive or a negative. And so when you have RH negative blood and you get pregnant with an RH positive baby, so your partner has usually positive blood, although it can happen spontaneously. When that happens, right, that positive blood gets released in the baby's positive blood gets released into your system, and your system goes, oh, no, foreign invader, no. And it creates like an autoimmune antibody response. And so the next time you get exposed to that positive blood, you'll have a reaction. Okay. So if you get positive with another baby, if you get pregnant with another RH positive baby, your body may try to attack that baby. So we give the RH negative, or the ROGAM, which is the medication to prevent this, at around 28 weeks, approximately. And this is to help try to prevent this reaction, okay? They usually don't give it early. You could ask your healthcare provider, but it's usually not given until like the baby's blood is really going to start circulating around and stuff like that. Now, once you have the baby, we test that baby's blood. And if your baby is RH negative, because we don't really know ahead of time, if your baby is RH negative when the baby comes out, you don't need another ROGAM shot. But if the baby is RH positive, we give you a second ROGAM shot, again, to prevent this from happening in your next pregnancy. For any of you who have a miscarriage or a chemical pregnancy or anything like that, you need to have a ROGAM shot after every single birth if you are RH negative. And this helps prevent that reaction. So I hope that I answered everybody's questions. Today was wonderful. My name is Dr. Samantha. I am the maternity mentor. I am a psychiatric nurse practitioner. I have over a decade of experience in this area. I am currently treating mood disorders for women and men who have postpartum depression, as well as women who are breastfeeding and have mood issues during their pregnancy. I would love it if you could subscribe to my channel. It really, really helps me out. Hit the notification bell, and you'll get notified of our latest content. Hit us up over on Facebook, Instagram, Twitter for additional content. Please share us with your friends and family. We really appreciate you. We are here every Monday at 9 p.m. Eastern Standard Time to answer your questions. That's what I love. This is my passion. I love to interact with people live, and I really hope this helped. Remember, you can always comment on any of the other platforms. Tonight, we had a couple people leaving their questions in the chat ahead of time. That was also fabulous. Feel free to do that. And, you know, the other thing is, if you have any suggestions, if there are videos that you want to see, please leave them in comments on my other videos. I see every single one of those comments, and I do respond. For example, I already think tonight I've got 2 ideas, the RSV vaccine, of course, and you know, using aspirin during pregnancy. I think that's a good one. So I really appreciate all of you. Thank you so much for joining us. I'm Dr. Samantha, the maternity mentor. Bye for now.